Welcome back, Dr. Patel. It's good to see you again.
Good to see you, Hema.
I am really enjoying the feedback and the learning around osteoarthritis of the knee and working closely with you. Some folks are now asking me, and I don't have the answers around what PRP is. Some doctors are prescribing PRP as a treatment option for osteoarthritis of the knee. What is PRP?
Sure, Emma. That's a good question. So PRP stands for platelet-rich plasma. Uh, so what it is that when you have this injection, they're basically taking out blood from your own veins, and they take out the blood sample, let's say about 10 to 20 ml, and they put it in a centrifuge, and that centrifuge spins the blood and concentrates all your platelet, plasma in one area. So now they take that plasma and then inject it into your knee joint. So that's PRP injection. So it's basically taking your own blood and getting the concentrate of the good cells that help fight inflammation, and then injecting into the knee joint. There's a lot of studies out there comparing PRP with other therapies such as steroids or even gel injections or physical therapy. And there's a lot of controversies too, because depending on what studies you look at, some studies show that there's benefit, some studies show that there's no benefit. And it could be because the number of platelets that are injected into the joint space, how much concentrate of the platelet. It's like taking a blood pressure medication or diabetic medication. If you take a small dose, you're not going to get a drop in your blood pressure as much as if you take a higher dose of the blood pressure medication. So same thing happens in the PRP, is depending on how many platelets are there in that concentrate. If you have a higher dose of that platelet, then you're going to get a better benefit compared to a lower dose. So there's studies comparing different spectrums of PRP. So it's not a definite treatment for osteoarthritis, but it has shown some benefit, improvement in their pain, and also functionality compared to other injectables that are out there.
So are you in favor of PRP, or do you see a benefit of actually patients opting for GAE instead?
So I mean, PRP is still it's sort of an invasive procedure, right? So they take blood out of you, then they spin the blood down, and then they introduce that blood back into your joint. So obviously, whenever you inject something into the joint, there's a risk of infection, introducing infection, that can, but these risks are very limited, very minimal. But again, it depends on the stage of your arthritis, who is a candidate for what. Every treatment options that are there, they're good for depending on what stage of the disease you're on, right? If you have mild disease compared to severe disease. So if you have a severe osteoarthritis, then no injection is going to help you because you're already on bone to bone. Those patients will likely benefit from knee replacement,
Right.
Or people who had PRP and they didn't get any benefit from it.
Right. Right.
So those patients would be, and who don't want knee replacement. So those are the patients who would benefit from GAE.
Can I just stop you there for 1 second, Doc?
Sure.
You say bone on bone. It's literally it's bone on bone.
Right.
And
so normally you,
yeah, go ahead. Yeah.
Normally you have between the two bones of your knee joint, you have a cushion called the cartilage. And that cartilage gets worn down over time. And it's a cartilage that releases all these inflammatory cells into your joint as a response to these micro traumas over time.
Right.
Those inflammatory cells actually cause the pain, the inflammation and swelling of your joint, and also further destroy your cartilage. So when it further destroys your cartilage, it even releases more inflammatory cells. Right. So it's a vicious cycle. So you have to stop that inflammation somehow. The PRP can help you stop the inflammation and also, improve on your pain. But with the GAE, it's more targeted therapy. Like PRP, you're just injecting that in your joint. and then seeing what happens. With the
Right.
GAE, you're targeting these blood vessels that release these inflammatory cells into your joint.
Got
So
it.
you get a better effect, immediate effect. And also studies have shown that when you do GAE procedure, you're no longer releasing these inflammatory cells into your joint. Therefore, you're not destroying your cartilage any further, and studies have shown that it allows the joint to heal also, the cartilage to heal. So some people have also, regrown their cartilage compared to
Right.
destroying their cartilage. So there's a lot of benefits with GAE compared to other injectable therapy. It's very minimally invasive,
Mm-hmm.
and it's an outpatient procedure. It's done in our office, and there's no restrictions, far as after the procedure.
I was actually chatting with a lady who's 76 years old, and she's been seeing a lot of different doctors, and both her knees have osteoarthritis of the knee, and she's absolutely terrified of surgery, and I mean, as a 76-year-old, a good candidate for GA.
Again, it's hard for me to just generalize and say, because you're 76, your arthritis, you're a candidate.
Right.
It's important for us to evaluate you, see where you are in the disease spectrum of your arthritis. Like I said, if it's just mild form, then, routine home therapy will be, sufficient for these patients.
Right.
If you're in the severe stage, then maybe knee replacement is a better option for you. But it's the middle spectrum where GA is very helpful for a lot of these patients, or who are not candidates for knee replacement, or a lot of these patients don't want a major surgery like knee replacement. So
Right.
GA is a great option for them, or these patients have tried, injections, steroid injections, a PRP or gel injections, and they work for them for 2-3 months, and now they get repeat injection, which works for another 2-3 months. And by the third injection, it doesn't work anymore. So these patients are great candidate for GAE,
Excellent.
who have failed other therapies, because it's very minimally invasive, and it's very, very effective, not only for the short term, but long term, up to 2 to 3 years. These patients don't require any more injections, or, there's studies that show that Dr. Okuno from Japan, his initial study from 2017 that showed that he took 70 patients with 95 knee joint treatments, and he showed that 28 of those patients were taking daily anti-inflammatory drugs like Motrin and Advil.
Right.
By the end of 1 year, only one person was taking it.
Interesting.
And out of those, 20 patients were getting routine knee injections. And by the end of 1 year, 0 patients were taking knee injections after having the GAE procedure done. So there is some good data out there for, supporting this procedure.
Excellent. No, that's excellent news. How can quite often the parents, aging parents, don't, they're in pain. So the kids want to make contact with you. What's the best way to get in touch with you, and what are the steps? Does someone have to meet with you in person for the first time to see if this is a good fit, if they are suitable for GAE, or can they do this through telehealth?
Sure. I mean, ideally, when you have a medical condition, it's always better to physically go see your doctor.
Sure.
Right? Because the doctor can always examine you, and also we feel better doing a face-to-face consultation than something over the phone. But initially, if they have questions, I'll be happy to answer them over the phone. Then, run through their scenario, what stage they're in of their arthritis. And then I can recommend, say, hey, is this something where I can help you? If I can, then, I'll have you come into the office and evaluate you. If I can't help you, then I'll at least tell you, based on what the information you're giving me, whether you would be a candidate or not.
Okay.
But initial screening can happen through a phone call or telemedicine. But if you're going to be a candidate for a procedure, I would always like to evaluate you first.
Okay.
It's very, there's a lot of information on our website as well. You can, our website is www.genicular avavascular.com. Avavascular is all one word.com. Or you can call our office. It's a simple number to remember. It's 1-833 leg cramp, LEGCRAMP.
And that's without an
1-833.
S. No
Yes.
S at the end.
No
Yeah.
S. It's leg cramp. Yep.
1-833 leg cramp.
Correct. Correct.
Excellent.
It's easy to remember. So.
Yes. No, this has been yet another very informative topic on PRP injections versus GAE. And I think that, I think that you give hope for patients who are A, afraid of surgery, but B, who are not winning with injections like PRP, to give them the option of another treatment plan. Is it one time, Dr. Patel, or is it ongoing?
No, it's one time, but we do one knee at a time. We don't treat both the knees at the same time.
Right.
And people need to understand that, osteoarthritis is a progressive disease. If you don't do anything about it, it is going to get worse.
Right.
So I recommend you getting some treatment depending on the stage of your disease. Are you in the acute phase where it's flared up, your knee is really hurting and painful? That would be an ideal situation where GAE can come in and help you relieve that acute inflammation.
Got it.
Acute. A lot of people have the chronic disease where, the acute phase has subsided, but they have chronic daily pain. So these patients will also benefit from GAE.
Got it.
By reducing their pain and improving their functionality. So, I think it's better to have something done than not have anything done, because there's a lot of options out there, for arthritis at the knee. But if you don't do anything, then obviously the disease will progress and it'll just get worse. It's just like diabetes and hypertension. If you don't treat it, it just gets worse. Like hypertension, if you don't treat it, then ultimately it can lead to heart failure.
Sure.
So it's better to, there's no one treatment perfect for everyone.
Right.
So we have to evaluate where you are in your disease and, find the right appropriate treatment for that stage of the disease.
Okay. Thank you, Dr. Patel. I look forward to meeting with you again soon.
Thank you, Hema. Have a great day.